Then activities of daily living or ADLs, and these tasks like eating, dressing, bathing, toileting, and ambulating. Then physical care, both invasive procedures like IV or catheter and non-invasive procedures like medications, repositioning, all fall under the physical care. Then informal counseling, providing guidance and support for addressing personal conflicts or emotional issues. Then teaching, an ongoing process that often is conducted by the registered nurses. So that is almost a part of the nurses because they do it now and again. Then we have indirect care interventions, benefit the patient but do not involve direct contact. And these include communication, essential for patient care support patient to the dietitian. Then research, gathering of new information and best practices to inform patient care. And this is now becoming part of the nursing because all nurses are supposed to be involved in research in order to improve their knowledge. Then advocacy, supporting and working on behalf of the patient. Then delegation, transferring responsibility for a task to another person based on assessment, findings, and care priorities. Skills for implementing nursing care. We have cognitive skills. This involves learning, understanding, and critical thinking. Then interpersonal skills, which involve effective communication. Then technical skills. This involves hands-on procedures for patient care. Process of implementing care, reassuring the client's condition, determining needs for assistance, and implementing nursing intervention. So these are the process of implementing the patient. We keep on reassessing the patient. We keep on determining the needs of for assistance. Then also implementing nursing interventions. Like for instance, we can reassess the patient and we realize that the patient needs to be bathed. So we bathe the patient. In nursing intervention categories, independent, dependent, and interdependent. So the independent one, these ones are the ones that the nurse can think of and intervene on her own. Like for instance, you have checked the patient is unclean, so you decide to bathe the patient. That is independent. Then the dependent, this requires guidance from other disciplines. Like for instance, from physicians, a physician can prescribe the drug, then you administer. That is dependent. Then interdependent interventions, this involve team collaboration, like I have talked about, involving the dietitian, involving a physiotherapist, all that fall under interdependent. And supervising delegated care, delegating tasks to nursing team members, then accountability for outcomes. So you as maybe if you're a senior, delegate some work to a specific nurse who is junior to you, but you will be accountable for that work that has been done. If the work that you have delegated is passing of a cannula, then evaluation of care, collecting data for comparison, comparing data with the desired outcomes, and analyzing client response, identifying contributing factors, continuing modifying or terminating care plan. So that is what the evaluation is all about. We collect the data, then we compare. When the patient came in, we checked the patient. This is what we found out. We decided to do ABCD. Now we check the patient again. If the patient came in with high blood pressure, we came up with a strategy of care. we have cared for this patient. Then now, when we check, is the blood pressure low or high? Then we compare and understand, and get to see the effectiveness of what we have provided. So then we analyze the response and identify contributing factors. What are those factors? If the outcome is negative, the blood pressure did not lower, what are those contributing factors? Could it be that the patient is stressed? Because if the patient is highly stressed and we have been pumping the patient with medicine without considering the psychological part of it, then we have failed on one way or the other. So we need to involve the other technique to make sure that we lower the blood pressure. So from there, we can now decide whether we need to continue caring for the patient. If the patient blood pressure reduced but not so effective, you're going to continue because you have hope that the patient is going to become better. If you see that it has not really lowered, then you may need to modify. Like I've told you that you may identify that the patient has stress, so you start counseling the patient, teaching the patient the relaxation techniques. Or if the patient has now become okay, blood pressure is okay, the patient is talking well, is eating well, everything is fine, then you can terminate the care plan. So that is what evaluation is all about. Then the steps in evaluation, collecting data, I think this one I've talked about it. I've explained this, you'll be able to understand. Then discharge planning, transitioning patients to next level of care. Then key elements of ideal discharge planning include the following. We have include the patient and the family in your plan. Discuss the key areas that you really want to emphasize on. If, for instance, if a patient is having stroke, the patient is going to be discharged home, but this patient needs to be changed. The position needs to be turned every now and then. This you have to focus on it because it is the point of focus. Then educate in plain language. Educate these caregivers in a language that they can easily understand. Avoid the use of medical jargons because this will make them not to understand what you are talking about. Then assess communication effectiveness on a patient and the family goals. Components of discharge plan, it is composed of the following. We have equipment needed at home. Like for instance, if you're discharging someone who is bedridden, you will need equipment like um, bed or an area that is specifically designed for the care of the patient because it's going to be a nursing home. So everything has to be prepared. You need to have that bed. You need to have a bedpan and the other things at hand. Then dietary needs or special diet if needed, medications for home, resources and emergency response, home care activities, summary of conditions, and to make sure that you follow up. So conclusion, effective nursing process. So in a conclusion, we have talked about comprehensive physical examination and observation, validation for accurate assessment, documentation for continuity of care, diagnosis and the personalized care planning, implementing interventions for positive outcomes. So that has been that for today. Thank you for being part of this learning. God bless you.